Tricks. So today's topic of the discussion is about the signs of pregnancy. See, when talking of the signs of pregnancy, what is there is there are certain signs what are subjective, that the individual, that the lady who is having pregnancy, she herself tells about such symptoms. So these are the presumptive symptoms. There are certain presumptive symptoms from which one can suspect that there is pregnancy, but there are certain positive or the definite symptoms which are the absolute signs of pregnancy. So in this video, I'll be mainly focusing upon the signs of pregnancy, and particularly the presumptive signs. For the presumptive signs of pregnancy, I'll be dealing up with the mnemonics. So in this video, I'll be taking up the mnemonics as to how we can very easily remember the presumptive signs of pregnancy. So beginning with, so these presumptive signs can be better remembered if we just remember the line that is A and M quickly bring females for surgery. So as you can make out, A&M, so auxiliary nurses and midwives. So these are the auxiliary nursing and midwifery courses are there, and so these women who undergo these training, so auxiliary nursing and midwives, they quickly bring females for surgery. Just by remembering this mnemonic, we can very easily remember the presumptive signs what are there for pregnancy. So just by remembering the initials, that is the A and M, A of the auxiliary, N for the nursing, M of the midwives, Q of the quickly, bring, the B of the bring, the F of the females, and S of the surgery will refer to one of the presumptive symptoms, will refer to the one of the symptoms which are there for the pregnancy. So beginning with the A of the A&M is referring to the amenorrhea. So whenever any lady is having loss absence of she is missing out the menses are not coming on the due dates. So if there is amenorrhea and the time at which the menstrual cycle on a usual trend happens, if it is not occurring, so that the lady might suspect, the lady might presume that she might be pregnant. Now, moving on to the next, that is N of the A&M, refers to the nausea and vomiting. So, amongst the presumptive symptoms, it is also believed that the nausea and vomiting are considered as one of the presumptive symptoms by which people presume that might be there can be a chance of pregnancy. The M refers to the frequency of micturition. It is usually seen that if micturition, the frequency of micturition is increased, by this also one can suspect that pregnancy can be there. Now the Q of the quickly, so the A&M quickly, so Q of the quickly, it is referring to the quickening movements. So do remember, these there are certain, the quickening movements means there are certain symptoms what the mother feels, that what the mother there is a sensation, there is a feeling that certain kind of movements are there of the fetus within the mother's womb. So these are the quickening movements which are perceived by the expecting mother, and these quickening movements of the fetus can also be perceived as one of the presumptive symptoms what can be looked upon for pregnancy. Moving on to the bring, the B of the bring, it refers to the breast discomfort. So these breast discomfort is also seen as in some expecting mothers, and this is another one of the presumptive symptom. Moving on to the F of the female, it refers to fatigue. It is mostly seen that during the first trimester of pregnancy, the most of the expecting mothers, they get fatigued very easily, they get tired very easily. So this is another one of the presumptive symptoms. Moving on to the S of the surgery, it refers to the skin changes. So there are certain skin changes what are also seen in pregnancy, such as the chloasma, the pigmentation of the cheek area, the pigmentation of the forehead. So there are certain skin changes which are usually seen due to hyperpigmentation, due to melanin deposition. So these are certain symptoms what can be looked upon for the presumptive symptoms, and these presumptive symptoms can be better remembered if we just remember the line that is the A&M, auxiliary nurses and midwives quickly bring females for surgery. So this was the mnemonic for the presumptive symptoms. So By this, just remembering this short trick, this mnemonic, you can very easily pen down in sequence in the professional exams as to how what are the presumptive symptoms. Moving on to the absolute or the positive signs of pregnancy. So signs are what the physician or the doctor is going to perceive. So these presumptive symptoms, they are purely subjective, whereas the signs of pregnancy can be easily detected by the physician by one of the following methods. Firstly, it is the palpation. So palpation of the fetal parts and perception of the fetal movements by the examiner can be done at about 20 weeks of the intrauterine life. So it is about the 20 weeks of the intrauterine life that the palpation of the fetal parts can be done, as well as the perception of the fetal movements is also can be also examined by the physician or the clinician who is observing it. Moving on to the next absolute sign, it is the auscultation of the fetal heart sounds. So whenever once a woman is referred to a gynecologist or an obstetrician, what they do is they are going to auscultate. They are going, with the help of a stethoscope, they are going to auscultate for the fetal heart sounds, and these fetal heart sounds can be quite evident if it is one of the absolute sign of pregnancy. Moving on to the next next method, that is the ultrasonography. So nowadays the ultrasonography or the USG provides evidence of the embryo as early as the 6 weeks of the intrauterine life, as well as later on of the fetus. The ultrasonography can also aid in detection of pregnancy. And moving on to the last but not the least, that the radiological demonstration of the fetal skeleton. So as the fetus is going to mature, the fetal skeleton is going to grow. So this, the radiological demonstration of the fetal skeleton at about 16 weeks and onwards can also be looked upon as that one of the positive or the absolute signs of frequency. So viewers, this was a very short video where I've tried my level best to help you out in giving you the short trick or the mnemonic as to how you can very easily remember about the presumptive symptoms of pregnancy just by remembering the line A and M quickly bring females for surgery, where every alphabet, that is A, N, M, Q, B, F and S, is going to correspond to one of the symptoms, the subjective symptoms what the women mostly find and they presume of pregnancy. So viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers who are new to my channel and they haven't subscribed yet, do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up, and if you want certain topics by me, you are most welcome to comment me in the comment section. I'll surely prepare them for you and will take a lecture on it. Thank you so much for watching.